Сайн байцгаана уу хүнд үзэгчдээ. Өнөөдөр манай Defacto нэвтрүүлгийн зочноор Монголд Нисдэг нүдний эмч нар гэдэг нэртэй алдартай сүүлийн 20 жилд нэлээд олон удаа ирсэн энэ Орбис ийм онгоцтой эмнэлгийн энэ байгууллагын захирал ноён Ranck оролцож байна.
Ranck, Орбис эмнэлгийн ерөнхийлөгч. Ranck Америкийн нэгдсэн улсын нисэх хүчний үйлдвэрлэлийн салбарт засгийн газрын хөтөлбөрийн дэд ерөнхийлөгч. Америкийн нэгдсэн улсын нисэх хүчинд гадаад дотоодын нислэг хариуцсан 30 гаруй жил ажиллажээ. Тэрээр DCR онгоцны нисгэгч, Америкийн нэгдсэн улсын нисэх хүчний бригадын генерал цолтой. Орбист байгууллагын стратегийг хөгжүүлэх, санхүүжилт босгох, хүний нөөц зэрэг асуудлыг хариуцсан ажиллахаас гадна донорууд болон засгийн газартай Орбисыг төлөөлж хамтран ажилладаг. Ranck Америкийн нэгдсэн улсын Батлан хамгаалахын их сургуулийн National War College-ийг үндэсний аюулгүй байдлын стратеги мэргэжлэр магистр, Golden Gate их сургуулийг нийтийн удирдлага мэргэжлэр магистрийн зэрэгтэй тус төгсжээ.
Good evening, sir.
Good evening.
So please tell us what is the mission this time about?
Orbis is out to change the way the world sees. Our vision is to transform lives by fighting through the fight against a blindness. With our network of partners and friends, we train, mentor, and inspire local teams so they can fight blindness in their communities. It's a sustainable project. It's a teach a man to fish operation as opposed to a give a man to fish operation. Mm-hmm. So every time we come in with the Flying Eye Hospital or with hospital-based training, our mission is to teach doctors, nurses, and technicians to fight blindness better when we're not there.
Please tell us about this origin of this Orbis, which is such a marvelous mission. How come? Please tell us what happened.
It was a wonderful combination of innovative ophthalmologists, doctors, and some innovators from the aviation industry who looked at the skills of eye surgeons around the world and said, how do we get them better training? You can't bring them to the United States because it's too expensive and there's too many restrictions, so how do we take the training to them? And the idea was to take an airplane, put a teaching hospital on the airplane, and take it abroad to people who needed training. And the response from the ophthalmology community of people who want to teach was overwhelming. And so doctors would fly to meet the Flying Eye Hospital to teach in various countries. To date, we've trained people in person in over 92 countries with the Flying Eye Hospital.
How many altogether professionals you have been trained?
Oh my goodness. I would have to dig for that number because it's pretty big.
Yeah, I can imagine. How many years, since when it has started?
If you look at annual numbers, if you look at just the Flying Eye Hospital, this is why it's complicated. The Flying Eye Hospital is one broadcast platform from which we teach. So we go to a country and we teach people in person. We do hospital-based training, which is a similar model, but without the airplane. We just go to the hospital and we teach. And then we have an online learning and collaboration platform called CyberSight. In CyberSight last year, we reached doctors in 125 countries. And we reached them in a variety of subspecialties. And we did teaching, we did mentoring, we did case referrals and collaboration on how to treat. We did online surgical mentorship, where a trainee in Peru had a complex surgery on a 6-year-old that she wasn't sure how to do it. So we had one of our mentors looking over her shoulder from the US, from 6,000 miles away, looking through the internet, through her microscope, as she was performing the surgery. So if she had any questions or if she hesitated, that surgeon, that experienced surgeon could say, you're doing fine, remember this, think about this is what's coming up next, this is what we talked about. Walked her through the surgery and it was brilliant.
So eye doctors are on plane, online, and on the ground.
Exactly. And we're true to the original mission, which was find innovative ways to bring that instruction to people who wouldn't get it otherwise.
And it means, since when it started and who started it?
The Flying Eye Hospital, first Flying Eye Hospital took off in 1982. The ideas and the collaboration that led up to that dated back into the 70s. And those personalities were trying to get the resources together for that Flying Eye Hospital. But we've been flying a version of the Flying Eye Hospital since 1982.
And it is the same plane, or you have been changing planes several times?
We have changed the plane 3 times.
Wow.
The first airplane was a DC-8, and it took off originally out of Houston, Texas, and it went around the world. It went to a lot of places and attracted a lot of attention. It lasted until the early 90s when we replaced it with the DC-10, which was a fundamental change in the design of the hospital because the fuselage, the tube was so much bigger. And that airplane flew until June of 2016 when we replaced it with the one that's here at Ulaanbaatar. It's an MD-10, and we've taken the level of sophistication up again. The hospital, as it's built into the airplane, is, the analogy I use is it's like Legos. They're all hooked together as little modules, and they all slide in and connect to the airplane. But the engineering is independent of the airplane. So it has its own power, it has its own water, it has its own airflow system, which is a hospital quality airflow system, its own sterilization and medical gas. So if the time were to come where we'd have to replace the airplane, we could take the hospital out, put a new airplane in place, put the hospital in.
So it's almost brand new one.
Right. The hospital itself is brand new. It was designed just for this airplane.
Wow. That means it is completely equipped with everything updated.
Absolutely.
Technology.
Absolutely.
Fantastic. The productivity is much better.
Yes. Alcon provided us with state-of-the-art retina and cataract machines.
Wow.
We have state-of-the-art anesthesiology.
Yes.
We have 3D cameras on all the microscopes and on all the exam equipment.
Wow.
Because it's a broadcast platform, it will broadcast in 3D to the 46-seat classroom, or to a partner hospital, or to the internet. In China recently, we did broadcasting in China for China, and had, I think, 450 locations dialed in to see surgery in real time. And when a teaching event like that happens, the surgeon is mic'd up. And he or she is performing surgery. There are trainees in the room. They're narrating what they're doing, and they're taking questions.
Wow.
So you have people in cyberspace asking questions, and there will be someone in the room saying, I have a question here from Xinyi, and this is what's going on. Or here's a question from Shandong. They want to know why you use this instrument versus that instrument. And what we found was when we do these live learning events in China, it's the most collaborative and back and forth because they're so delighted to be doing it all in Chinese.
Very noble mission. How about this time in Mongolia? What is the specifics of this program compared with the previous 5-6 times in Mongolia?
This time we are, it's a 3-week program, and we're excited. The first week is all pediatrics. It's pediatric strabismus, pediatric cataracts, some oculoplastics. I learned from working with the volunteer faculty, my vision, or no pun intended, my impression had been that congenital cataract was a child who was born who couldn't see because he had cataracts. Not necessarily true. A child can be born with a cataract, but it's not really well developed, so they can see through it. They develop, but 5 or 6 years later, they can't see through it anymore and it needs to be replaced. So we are doing congenital cataract surgeries on children from 3 to 16 years old. Several oculoplastic surgeries. The second week is all simulation. We've launched a new effort thanks to United Technologies Aerospace Services to bring in the best simulation technology on the market and use it to train surgeons on part task. This is how you make the first incision. This is how you make the first suture. This is the tool to use instead of this tool. Try it again. Do it again. Try it again. Till they can master part tasks without ever seeing a patient.
Wow.
On the airplane, we have a cataract surgical simulator. We have a retina surgical simulator. We have a pediatric anesthesia simulator, and we can put up to 5 training stations in place and train 3 or 4 residents at a time who can look at each other and how their work is doing, trade feedback, go back and forth. You try it, I'll try it. You try it, I'll try it. And have a mentor looking over their shoulder saying, have you thought about this? Rest your hand this way. A lot of wonderful learning happens that way.
And third week?
Third week will be adult. Adult cataract, adult glaucoma. And since cataract and glaucoma are the first and second causes of blindness amongst adults in Mongolia, we thought that was a good place to be emphasis.
Would be interesting.
We find that cataract tends to be a high prevalence item in populations that spend a lot of time outside. A lot of time exposed to UV. And that's a correlation.
Cataract, and you said what is the second one?
Glaucoma.
Glaucoma. That would be why.
I don't know what the cause would be trend-wise from an epidemiology perspective.
This time, mostly, probably, all Mongolian eye doctors can have access, no? Or who is organizing it in Mongolia?
Our partners here for the training right now are the Mongolian Ophthalmology Society, the National Center for Child and Maternal Health, Hospital number 1 and Hospital number 3, and the senior mentor of ophthalmology in Mongolia, Dr. Basanku, who, by the way, used to be a staff ophthalmologist on the Orbice Flying Eye Hospital. Yeah. She probably met so many people looking at the world now with their normal eyes. She's a gifted person. Yeah, we lucky to have her. You yourself joined recently this flying doctor hospitals. Why you have decided? You yourself being a military high-ranking officer, and then you have joined this interesting mission, and why you have done it? For me, eye health has always been a very personal conversation. My father was a glaucoma patient. All of my mother's relatives had cataracts. I struggled with refractive error in my flying career all my adult life. So when we talk about eye diseases and things phenomenon of the eye that can prevent someone from achieving, I became very familiar with all of them. But for me, the impact was minor. It was one small thing at a time. But I knew people whose careers had been stopped because of an eye disease, or their progress had been stopped because of a trauma to the eye. And to be involved with an organization that can help people get past that seemed to be the opportunity of a lifetime. Well, and it really has been.
Just flying takes how many logistics? You are flying doctors, hospital, crew, and yet they have to take everything with them, and they have no mistake. It's a lot of work and logistics.
It is.
How do you do that? How many people work on that part?
You know, in the Air Force, we used to say on a cargo airplane, the smart pilot steps on board, the young pilot steps on board and goes into the cockpit. The smart pilot steps on board and turns towards the business end to make sure that everything is in line for the mission. And the same is true with Orbis. The pilots can take care of the front end of the airplane, but it takes a staff of almost 30 to take care of the clinical needs, the logistics, the stocking of the airplane, to make sure the right consumables and medications for each program are on board. We have a small United Nations in that airplane. I think we represent 24 countries in that staff. And they all are team players. They want to see what else they can do to help someone that they work with.
How they are paid?
They're paid as staff, full-time staff with Orbis. And then the doctors, the volunteer doctors and nurses from around the world fly in and fly out each week with the program. All of the pilots are volunteers from FedEx. They
Wow.
take their vacation time to come to the airplane, pre-flight it, fly it to the next program, make sure it's all buttoned up and safe, and then fly home.
Huh.
And our doctors, we have over 400 doctors from 26 countries.
Okay.
And they are absolutely phenomenal.
And all
Teachers,
they do voluntarily this job?
all of it,
Okay.
yes.
Oh my goodness. How about nurses?
Nurses also,
Voluntarily.
volunteers.
What a mission, huh? How then do you cover the cost?
Individual donations.
Individual. And
We
people
have-
donate.
People donate. We at our website, www.orbis.org, we have it in multiple languages, depending on where you are in the
Yeah,
world
I
when you
saw
bring it up.
in many languages.
And-
And the donations, everybody can, whoever likes, they can donate the money to whatever size they want to give money, they can do it.
Yes. Now we also have some wonderful corporate partners. You could not operate an airplane like this without the help of Federal Express.
Yes. Who are they?
FedEx,
FedEx,
Boeing,
Boeing, okay.
United Technologies,
Okay.
United Technologies Aerospace Services specifically, and they sponsored the simulation program. But then we have some sponsors that you wouldn't think. Alcon is another big sponsor. They're part of the I world. So you have
Okay.
aviation and then eyes. Omega.
Oh, okay.
They are big-hearted people. They're the ones who sponsored Daniel Craig to come out here and film the special about Orbis in Mongolia.
When was it?
2011. And I believe he got married on Saturday, flew on Sunday, and he and his wife spent their honeymoon here
Wow.
filming that special.
Well, we didn't know somehow. Maybe
And they tried to keep it quiet, but even the hotel clerk knew who James Bond was when he checked in.
Oh, I see. All right. So this is a work of many people who really want to make changes in life, in the world. What is the best experience you have seen during your career here with Orbis?
Oh my goodness. It's hard to say in detail my most meaningful experience because you'll see tears on your table.
Wow.
Okay? There is nothing more impactful than seeing someone gain their sight back. If you want to see pure joy, watch the patch come off from someone who has been bilaterally blind and see the expression when they can see again. Wow. There's nothing like it.
Yeah,
and we're doing that this week. Next week is simulation. Third week is also surgery and post-op days. I invite you to come to one of the post-op sessions and see that for yourself.
Oh, I'd love to.
It will grab you by the heart.
Well, that gives you a lot of energy, I think.
It does. It does. I wake up every morning very motivated because I love what I do.
Wow.
And everybody at Orbis stays there because they love what they do. We get up in the morning knowing we give back to people who can never pay us back.
Giving. Such a feeling. We, in Mongolia, of course, the plane is well known. Because, even from my very young age, I know that there was a flying doctors coming with the name Orbis, blue and big plane. I was always wondering how come then hospitals can fly. I was always thinking, and now with your conversation, I wish more people now, I understand more people will understand why is that noble vision can exist like this, because it's a will of so many companies, people, and most importantly, it leaves big potential knowledge for our doctors, nurses, who can take care of the people who have difficulty for seeing. How do you see the future of this? Maybe many planes, or how do you see that?
I see us doing more innovation. I see us working hard to change the way diagnosis is done. There is, I had a great conversation last night with one of our partners, Dr. He Wei from China. Medicine is in many places, is in what I call a retail model. You need something, you go to the big box, you get it, you go home. Retail is transforming with the Alibaba and the Amazon model. Is that transformation on the horizon for medicine also? Can artificial intelligence and imaging from a smartphone be used to take a picture of my own eye and send it to an ophthalmologist and say, do I need to come see you? Because eye diagnosis is not transient like a fever. There's a picture, there's a symptom there, I can send it, and someone can say, oh, you're fine, that's normal. Or the software can say, that's normal. Or someone can say, get to care now, go see a doctor. And when that transformation happens, it will change what I call the patient logistics equation. Right now, there are hospitals that send buses into the countryside to bring in people to give them checkups, to give them eye screenings. And the majority of them, 75 or 80%, go right back home, you're fine, you're good, thanks for coming.
And however, I understand this artificial intelligence, all the sophistication comes to even medicine, to eye doctor, the eye hospital. But however, because this inequality, because this economic development, poverty, in particular developing countries, where unfortunately in some cases government are not always doing right policy which don't make people wealthy. In these countries, and the majority of the countries in the world are like this, and still you need to deliver to this poor people, all this medicines, everything, doctors, right? And I think other than plane, you cannot think out something else that can be effective. So I think the world will need more and more Orbis. What do you think? I think the way the demand is, I think it's just one plane at the end.
One plane, a lot of innovation.
Yes.
The poor countries you describe may have no roads, no electricity, no running water, but they all have cell phones.
True.
And
nowadays,
so you
yes.
have cell phone connectivity and charging in places where there is not physical infrastructure that you and I may think of. And so if we can leverage that cell phone and handheld infrastructure to bring care to them or to bring them into care, then we have made the care delivery system more efficient. And in ophthalmology, that is so critical. Once they know they need care, then we can help with that infrastructure. Our partnership with governments is that, okay, we brought people in and we showed them that they can be more productive if they have spectacles. But if the government doesn't have that on the insurance, then our job is to sit with the government and say, 15 to 20% of your children need spectacles, please put it on your insurance. And they may not know that 15 to 20% of the children in their country need eyeglasses. And our role is to make them aware of that so they can say, oh, we can do that.
Yeah, in particular with the eyes, insurance is expensive. And those lucky handful of people who you can see compared with the population are very lucky to have this. And it is not only ophthalmology issue what you are talking about. It is illness of all other illnesses that can be also having this sort of approach. If there is any kind of Orbis for other diseases in the world?
Not that I'm aware of. There are mercy ships, there are smile trains, there are Operation Smile that focus on different types of care delivery. But we're unique in that we're doing teaching and we're building the capacity of local medical teams so that they can perform when we're not there. When Orbis leaves, the child at the front of the line knows that we've left behind doctors and nurses who can take care of her. And I think that's very, very important, that we're continuing to improve the care. We have a doctor with us this week who's this, I think, his third time to Mongolia.
Wow.
And after screening day, he felt compelled to stand up with the rest of the faculty and say he was delighted to see the magnitude of the change in the sophistication of the doctors and the nurses and how they have continued to learn since the first time he was here, and that the model truly works, and he was excited to be part of that long-term continuing progression of learning.
Very interesting. Which nationality?
It was Dr. Song, and he's from the United States. I think he's Chinese heritage.
And 3 times in Mongolia, and you have seen the changes with professionals, with equipment, everything, right?
Yes.
Wow.
The Minister of Health was out of the airplane yesterday, and we had a wonderful long discussion about the partnership. Orbis will train, we will upskill, we'll lift all the nurses, the technicians, the surgeons, the anesthesiologists, and help make everybody better. And then along the way, as we do that, there will be equipment. There will be incubators, oxygen blenders, microscopes, x-ray machines, that as you build the budget for the hospital, that has to be maintained.
And plus they see the brand new one, the latest technology. And
right. We can introduce that technology,
which
but we
already doing.
But we can't maintain it.
Yes, sure.
The budgets and the hospital budget, the government budget needs to be our partner.
Setting new standard for
right.
planning and for using and for training as well. Very interesting. I mean, a country, what is your priority putting a country to go? How you do it? How, to Mongolia maybe? Probably you will not come next year, every 4 years about one country. How you do make the list?
Well, first we go where we're asked. We will always go where we're invited. And second, it has to be a place that has the need. And it has to be a place where our teaching can be sustainable. And so we've been in some countries for a long time because the need is so great, and we keep expanding into more and more rural areas. In October, we celebrate our 20th year in Ethiopia. Wow. We have built over 250 primary eye clinics and turned them over to the government to be run. But we've trained and staffed and continue to upskill all of the staff who do that primary care for the villages. And as development expands into southern Ethiopia, we're expanding with it. And we're fighting trachoma, blinding trachoma. With repeat infection, it's 100% chance of going blind. And they have prevalence rates of 35%, where 35% of any given village was going to go blind.
Wow.
We have been working there long enough that 26 districts now are trachoma free.
Compared with this problem, Mongolia is much better. Still, the country is rapidly changing, of course. Our infrastructure is making better, but still a lot to improve, still to outreach everybody in this remote, very far distances in Mongolia. Wonderful talk.
Thank you very much for having me. Thank you for letting us have a voice to the people of Mongolia. And with 40% of the population being children and our program being focused on children, it's a great cause for optimism.
Thank you so much to you and to your team.
Thank you.
Thank you. За хүн үзэгчтэй өнөөдөр манай Defacto нэвтрүүлгийн зочноор Нисдэг нүдний эмнэлекийн дарга ноён Bob Ranck гэж хүн оролцлоо. Их баярлалаа.